16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
The greatest gift that you can give yourself and your family is a healthy and happy you. Good evening everyone, this is Anupama Menon welcoming you to a new episode of BMC Global Live Hilal Health World, Nothing But Lifestyle. In this talk show Health World, we have expert doctors from various fields providing valuable information on different medical topics so that we can assist you on your journey towards good health. 29th September is World Heart Day. A good and healthy heart is central to the overall well-being of an individual. And as we all know, studies show that heart diseases are on the rise in today's times. Today, to throw more light on this topic, heart diseases, risk factors and prevention, we are happy to have with us Dr. Rahul Abbas, Consultant Internal Medicine at Hilal Hospital, Adliya. He comes with a wealth of experience with over 15 years of experience in the field of internal medicines. So let's go over to him and know more about this. Doctor, welcome to the show and thank you for joining us.
Thank you. Thank you for inviting me.
So heart diseases is a very general and broad term.
Yeah.
So as a layman, when we talk about heart diseases, only a few things comes to our mind, maybe a heart attack or a stroke or a block. So could you please explain what are the other different types of heart diseases that are prevalent?
Yes, as you said, correctly said, Anupama, people when we say about heart diseases, they just make it like a block. This is the common term for any heart disease mentioned. Well, there is no harm in mentioning that, because the majority of the heart diseases which we come across are basically these vascular diseases, or the diseases affecting the blood vessels supplying the heart, causing a block inside the blood vessel, causing a heart disease. This is the majority of diseases which we see. But other than that, as you said, other than that, there is a large spectrum of diseases. If you look at the our textbooks of cardiology, you have a very large group of diseases which I think I will take more than a day to describe. But in short, I can explain to you in few common terms which we can understand. See, this heart is supplied by blood vessels. So any disease supplying to the blood vessels supplying to the heart, we call it coronary artery disease. Coronary means pertaining to heart, artery means the blood vessel and the disease. So this is one big huge common segment. The other segments can be the diseases to the muscles. See, heart is a soft tissue, it's a muscular tissue which is pumping. So this muscles can be affected. So there are a group of diseases which affects the muscles. Now there are a group of diseases that affect the valve. So if we were talking this about heart diseases maybe in the year 1980 or 1970, we would have been talking much about the valvular diseases, the valves that are there inside the heart and the diseases pertaining to the valves. Thanks to the medical and surgical interventions, these diseases are now slowly fading away from the face of the earth, and the vascular diseases are predominant.
On the rise.
Yeah, on the rise. And another sector is there which is less talked about, 5% of them are the rare heart diseases. Now when I say less talked about, it is 5%. It's a huge number basically, and they include these genetic heart diseases and some heart diseases caused by some organisms like Chagas disease, just a name I would like to mention in public, and one old disease which was very prominent in the developing countries before and now also in some part of the developing countries called rheumatic heart disease. Now this rheumatic heart disease is one such disease which is affecting the valves. Now these were there once very prominent, now they have faded out. So in short, if you ask me the heart diseases, we will make it in the vascular heart diseases and the heart diseases pertaining to the muscles or to the valves. When we say about block, so common man always has a belief that whenever they see the word block, they tend to perceive that there is a block inside the blood vessel. But if you look at a doctor's side, when we say block, the block is something different. Here when we say block, we means that there is a block in the conduction system. Means, as you must be knowing that when the muscles are beating, there is something that is stimulating, that is a current, literally a current that is flowing from the heart through the muscles, making the heart muscles to contract. So this current flow is the reason why we are having a contraction. So when there is a block in this conduction of this current, we say heart block. So whenever somebody sees a ECG or a doctor saying that, oh, there was a block, do not judge themselves stating that, oh, there is a block in my blood vessel. Okay. It may be only a block in the conduction system or the current system. Okay. That is also one group of diseases. They are also dangerous, but they can be very mild as well. Okay. So you don't have panic when we see the word block. Okay. So whenever you see a block, just discuss with the doctor, but don't have a feeling that this is a block inside your blood vessel or that you are having a heart attack. It need not be that. It could only be a block in the conduction system. So your question, Anupama, was the diseases. So I can just summarize once again. The most majority chunk of the diseases are basically the coronary artery diseases, where the disease is inside the blood vessels supplying the heart. Then we have something with the muscles, disease affecting the muscles, diseases affecting the valves, and now you have heard about disease affecting the conduction system or the current. So in short, I can summarize into these headings.
These three. Yeah. Okay. And doctor, so what are the risk factors that could lead to potential heart diseases? Yes.
Now since it is a World Heart Day and you are mentioning about 29th of September, well, World Heart Federation would like to convey in this year something very interesting. So what the federation would like to mention is that they would like to say heart for your heart. So a heart for your heart. So, what they intend to say, they have 3 pillars which says that a heart for humanity. A heart for humanity means that see, you must be aware that every one of us must be aware that there are heart diseases and there are provisions for care, for treatment and for cure. So, let us spread on this World Heart Day to come that heart for humanity. Let us spread awareness among people that you have every facilities nearby or a bit far to get the best care for heart diseases. So, there was a time when you have heart disease, you have nothing to do. There was a time when people believed that there is a block, then that is the last. There was a time people believed that bypass surgery means death. So, it is all over now, you have all facilities. So, heart for humanity. Then the second pillar they would like to mention is heart for nature. What is heart for nature? Let the World Heart Day, let us spread the news or the point that air pollution itself is killing more than 75 million people. So, if you can use your heart to spread the news that let us cycle more than using a bike, let us walk, let us use alternative measures so that we will reduce air pollution. Now, I know this has got nothing to do outwardly when you see on a Heart's Day, why should you say that air pollution is so dangerous that it is causing so much of cardiovascular diseases. So, okay. Heart for nature. And the last and not the least, heart for you. Heart for you means you must understand on this day that you are valuable. For you, you need certain things. One, regular sleep, entertainment, you must be happy, you must be laughing, there must be social interaction, you are a human being. And you must have regular exercise. Now, let us put on this day this message that you are valuable and that you need to sleep, you need to eat healthy food, you need to do regular exercise and you need to be healthy. So, this is what the 3 pillars that on World Hearts Day the Federation would like to convey to the public. Well, so coming back to you, the risk factors. Yes, exactly. So, risk factors of heart diseases is a huge one. So, I can very well explain it to you in 2 branches, like okay. They are divided into modifiable and non-modifiable. So, people will now listen, what is this thing, what is modifiable, non-modifiable. Non-modifiable are those risk factors which you cannot change. Say for example, one risk factor of heart disease is family history. Now, you cannot change that,
beyond our control. Yes.
Aging, you cannot stop your aging.
Yes.
So, your race, your aging, your family history are some non-modifiable risk factors. So, let us not discuss much on that, which we cannot do anything. There is a peak segment of modifiable risk factors. Say for example, very commonly we heard about diabetes, hypertension, cholesterol, very 3 common things. Obesity, very common nowadays and most common factor now, obesity. Then you have other non-modifiable, other modifiable which are not diseases. Say for example, smoking, sedentary health style, stress, sleeplessness. Now, these are also modifiable risk factors, but they are not diseases. So, if you look into this, even in the modifiable risk factors, we can divide into diseases and not diseases. In the diseases, we come across diabetes, hypertension, cholesterol, obesity, depression, a big segment. And on this side, we have smoking, sedentary lifestyle habits, sleeplessness, and over stress, anxiety. Now, if you can reduce these risk factors, which I mentioned, reducing these risk factors are actually giving you more life for your heart. So, these are in short the risk factors. Now, if you ask me, doctor, about diabetes or hypertension or cholesterol, we have heard enough of that. And I am very sure that these diseases need no introduction now. Every layman,
it's prevalent everywhere, and people also have some awareness already about these issues.
That is a good thing about all these platforms, social media platforms and all news platforms, which have given plenty of data to people about diabetes, hypertension and cholesterol.
But how do these 3 contribute to heart disease?
Very good, very good. So, when we always speak about them, we speak about those diseases as such. Yes, Anupama, very correct. See, how does diabetes cause a heart disease? Of course, diabetes is something to do with the blood sugar and insulins. Why should it cause heart disease? Now, when we say heart disease, I told you, we are describing about something called the vascular disease or the vessel disease, because the disease is inside the vessel supplying the heart. Now, diabetes is basically a vascular disease. If you look at the latest definitions of diabetes, diabetes is no more a disease of sugar or insulin. It is basically a vascular disease, a disease affecting the blood vessel. So, once you have uncontrolled blood sugars, you must understand that what is going to happen is the vessels or the lining inside the vessels are going to be damaged over a period of time. And when the area inside the vessel is damaged, there is more chance of blocks or clots inside it, and in due course of time you have a heart disease or a kidney disease or a retinal disease, or you have non-healing ulcers of foot. So if you look at all these complications of diabetes are all basically vascular. There are of course a few non-vascular, but all these are vascular or vessel diseases. One among them is the heart attack, or what you mentioned, stroke. All these are vascular diseases, the diseases inside the blood vessel caused by diabetes. Similarly, blood pressure, just like that for a common man I can tell you. See, I am pumping water through a pipe. When I increase the pressure through the same pipe, you know that the effect of this high pressure flow will definitely damage the pipe even if you are using it at home. Imagine in your system when you are having a very high pressure through these soft smooth blood vessels, they will damage the blood vessels, the soft lining inside the blood vessel will be damaged. You will again have a clot. Similarly, your cholesterol, you know, cholesterol is what is causing these blocks. So if you have more cholesterol in the blood, more cholesterol gets deposited in these damaged areas causing a block. So all these diseases, though they are themselves a disease, they all cause effect on the
They're linked to heart disease as well.
To the heart
people
diseases.
having these three conditions are more prone to having some form of heart disease.
Perfect. Not some form, they are the ones actually now causing
the high
this,
risk
the higher
category.
risk category.
And you also spoke about obesity as one of the factors, and in today's times we have seen, you know, that's one issue that a lot of people grapple with. So is there a link between obesity and heart disease also?
If you ask me, yes, then now this is what we all must put more light upon, that let us now, since we have a good idea about diabetes, hypertension, cholesterol, and very commonly heard about, one thing very underlooked is obesity. If you look at the appearance of human beings as such over a period of years from 1950s to 2030, you look, we are becoming more and more obese. You look at a child, if you look at a school, take a picture of a school which was maybe in the year 1960 and look at the classroom of a 15-year-old school child, you will hardly see one obese child in that classroom.
Yes.
But you take a classroom now, any part of the world, and you will see maybe one or two people who are slim. So even children are becoming obese. Now when they are obese in school, they are of course going to be obese in their teenage, in their adulthood, and in their elderly life. Now this progression of obesity is now very prevalent. Now coming to your question, that how does this cause? When you are obese, there is more fat inside your body. Now when there is more fat I would say right now is basically like a villain in your body now. So more fat inside your body, there will be something that is you are prone to called metabolic syndrome. What is called a syndrome? It is a constellation of diseases. More fat inside your body, this fat will produce changes leading to something called insulin resistance, a very commonly spoken term, insulin resistance, where you have insulin inside your body which you are aware of, their function is to carry sugar to the tissues. So what happens is that when you have more fat, this insulin becomes resistant to act. So now this insulin will not be able to carry the glucose molecules or the sugar molecules to the tissues. So more insulin in your body will be there, you have more and more insulin, but the insulin is not doing its function. This is called insulin resistance. In short, what will happen? There will be more sugar, more vessel damage, more heart disease. So though it is diabetes that is coming up, it is not basically that you are diabetic that happened. You are obese, you are more fat produced insulin resistance, and now you are diabetic. See from where to where we reached. This is the reason why patients do tell us, doctor, I don't know how I became diabetic. Now you don't know, you should know this is how you became diabetic, that you were in a school, ask yourself how many hours of physical activity did you have. Basically people don't have numbers to mention even, and they are obese. The diet you are taking makes you obese, and at the end of the day this obesity leads you to have all these diseases, say fat leading to cholesterol, fat leading to diabetes, fat leading to hypertension, and all leading to
eventually leading to heart disease.
Exactly.
And as you rightly mentioned, there's a rise in obesity amongst kids these days.
Yeah.
So at what age should this be tackled? Is there any age, during which an obesity issue can be addressed and lifestyle changes can be brought about?
Yes.
Or do you think in kids it can be ignored and maybe at a later stage we can take care of it?
Yeah, then I would like to bring some light into our cultures. See, a chubby child on a picture, 3-year-old chubby child running, is considered cute. Of course, thank God, it's cute, no doubt on that. But do we want a chubby child is this question that scientific we must answer. Because a chubby child looks chubby and always chubby through this age group, and then you find at 15 the child is obese.
Still chubby.
Yeah, chubby, and then at that time the child will not say that I'm cute, or nobody is going to consider that. But what has happened is, from this first day when we see a child, we do not want the child to be chubby. Oh, of course can be chubby, but should not be obese.
Beyond a certain stage.
So there is a weight that you can have from your birth to your death. So this weight has to be maintained. There is no reason that we should feel more happy when we see an obese child. I can just mention you, there are diseases called nephrotic syndrome, which is a kidney disease affecting children, very common. When these children looks very obese and very round and very cute to look like. I would then used to tell these patients, the parents, that see, whenever you see a child who is chubby and sweet, do not entertain that. It's actually not sweet. It's not good. The child needs to have only the weight for this age. So from that day to any day, you must be able to maintain your body mass index, the weight that you need for that age. So there is no age to curtail obesity from your birth.
Right, from birth, healthy lifestyle, healthy eating.
And all what you can do to make sure that the child does not gain weight has to be practiced all through. Because what you sow now is what you reap later.
Yes.
So you are sowing the seeds of obesity, fat in a child, you will reap the diseases of diabetes, hypertension, cholesterol, or even heart disease at a very, very young age.
Yeah, and at a later age, I guess it becomes more difficult to control the obesity. True. Because you've been used to a certain kind of eating habit, eating
and physical activity.
Activity also. So
I would like to mention something, Anupama, that's something called a habit. Now, how often do you think that you must brush your teeth today? You don't even think. You don't even think, right? You just go out morning, you brush your teeth. Did someone ask you? No, did you think that, oh, today I have to brush my teeth? No, you don't. Why?
It's ingrained into us.
Exactly. It's a habit that you develop from your birth. Why is it that when you wake up in the morning and you think, should I jog today? Why you think that? Because this is not a habit. If from your school days or at home you find that, just like brushing my teeth, that jogging or walking or doing any physical activity of that sort, say swimming or yoga, whatever you practice, you imagine that this has been a habit that you do 30 minutes in a day, from the day you started your father doing it and you started doing it from that day. Imagine at 25 you don't have a problem, at 55 you will keep doing it. Just like the military men who are trained from their adulthood to train, they retire and they do their training regularly. They feel that they are uncomfortable if they don't do physical activity. So the point was, if you are doing a exercise from a very young age, you will keep doing it without any trouble. If you are having a very healthy diet from your childhood, you will be following it till the last day. Now this will help prevent all these diseases. All these diseases I can tell you. At least though we cannot eradicate it, but at least we can delay it. At least not at 20, you don't have to have a heart attack at 20 years. Maybe you can have it at 70 or 80 years, but not at 20 years.
20 years.
Yeah, so
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Because that's one thing we've again observed in recent times, because earlier we had this conception that, you know, only people above a certain age group, maybe after 50s or 60s, are prone to heart diseases. But of late we hear of so many young people dying all of a sudden of heart attack, you know, the youth especially who are in their 30s or, you know, late 20s. So is there any particular age group which is more prone to getting a heart disease?
Yes, I will just like to remind, thanks Anupama, you asking this question. I can help you with a dictum which we used to practice when we were in our college days, that when we are in our medical schools, a patient who comes with chest pain less than 40 years of age, we will never could have considered a heart attack in him. So when I was doing it in the year 2000 or so, we will never consider less than 40 years to have a heart disease, because it could be some commonly called gas or muscle pain or whatever else, but it's never a heart attack because we never had it. Now imagine a 20-year-old or a 17-year-old boy comes to me with a chest pain. I am thinking it could be a heart attack. Why? What has happened? See, if I take you to this 20 years back, this guy who is 40-year-old, he had an extremely good physical activity, extremely good and safe diet, at least till his 15 to 20 years of age. Maybe he lost his physical activity and his diet after 20, so that at 40 he had his complications of heart diseases. Now look at our younger generation. Their health is lost from their birth. They are not into diet. I don't say you must take a diet, at least healthy foods. They are not taking healthy foods. They are not having good sleeps. They are not having any physical activity. How many hours your child plays is a question that I can, you know, extrapolate to any extent, because no child is now doing this physical activity as they should have done in this 1980s, 1960 eras. So absolutely less physical activity, absolutely unhealthy diet, very less sleep, more of stress and pressure for kids. What is happening inside them? Their vessels are being damaged. Their stress factors, the hormones rise, the vessels gets damaged. Slowly over a period of time, by 15 and more, their vessels are now
already damaged.
Yeah, and by 2025 you have these diseases. Now there is no surprise that you see them, and you see the latest studies from US saying that their age lifespan has drastically come down. Why? People are dying much earlier now, because they have diseases much earlier, because they have never lived as a human in their childhood. We are more prone to be in front of laptops and computers and classrooms rather than playgrounds. Oh, how often do we come across a playground now? How often do you see kids playing? Very rare sights now. This should be practiced. Let us use this World Heart Day to spread this news or this awareness among people that
activity, and
it should start from their childhood. They must play. They must have enough and more time than they study should be in the playground, because we don't need kids with more brain, but we need our kids to stay up to 50, 80, 90 years rather than die much early with a good brain.
Doctor, I would like to ask you, is heart disease hereditary? Let's say someone in your family has had an heart issue. Are you more prone to getting it, or can it be prevented? Even if it runs in the family, can this be prevented?
Okay, good question, Anupama. Now, Anupama, there are of course a set of diseases of heart which runs through the family. But there are a large number of diseases, or the large segment of common diseases which we see, the heart diseases, are not familial. Okay, but there are, of course, as you said, this small segment is there. Say for example, you have a very strong family history of heart disease, where the pedigree tree, the chart shows that you have a very significant people suffering from heart attacks secondary to blocks inside these vessels. Yes, you are prone. Now, when you are prone, it does not mean that you are going to have it, you are prone. So your point is what I want to answer. Is there a way to prevent? Yes. Maybe you are prone, true, genetically you are prone to have a vessel damage and a block, but let us start the preventive measures, let us start the diet, let us start the physical activity, let us control all the risk factors, let us sleep properly, let us control our body weight, let us not have diabetes, hypertension and cholesterol, let us live very healthy, because we know that we are going to be having heart disease. Above all, let us evaluate ourselves regularly. Let us do a checkup. We have all the resources, we have all the sources, but how often do you see a doctor for an echo? How often do you see a doctor for a treadmill test? You know that you have this risk factor. You know that my uncle at 28 had a heart attack. You know that my father's younger brother died at 30 years of age. Now, you know all this because of heart diseases. Then why don't you do it? You go to the hospital, do a checkup, let them do the basic evaluation and make sure that you are staying healthy. And you follow a diet and exercise properly with all avoiding all risk factors. You will see that you will not have this disease affecting you, because you are able to predict by blood tests, by echo, by treadmill test, or if necessary angiograms, to help you understand whether the vessels are going to be blocked or not. Now we have latest inventions where you just have to do a CT. You don't have to put in something inside your vessel to see there is a block. You can take a CT scan and see that you can have a block or not. So even if you are having a family history, even if you are prone to have a disease, we can find it very early. We can take all measures so that you will not be having a mortality much just like your parents or your poor parents would have had. So it is preventable. It is preventable.
It's comforting to know that. I guess lifestyle changes and regular checkups,
yeah, checkups.
Like you said.
That is one thing. So when we are stressing on lifestyle changes, which have been heard very commonly by public, they don't now. I think they are not much into evaluating, because going to a hospital without a disease, why? This is why. This is what is confusing. Now, when we talk about lifestyle diseases clinic, they are clinics which are run not for treating diseases, but for giving you an idea that what is the chance you can have a disease.
And to prevent it
yeah,
before
and
it
to prevent
happens.
it. I can give you one example. Now, there was a time years back when we were studying medicine, many of these complications were guesswork, like you are diabetic, you may have a heart disease, you have cholesterol, you have to start this medicine, otherwise you may have a heart disease. These mays were much commonly used. But now you have quantitative data. You can calculate your risk. Say for example, if you have cholesterol, I can use a scoring system to tell you what is the chance for you to have a heart disease or a stroke. What is the chance that in 50 years, on the lifespan, what is the percentage chance you can have a stroke? In the next 10 years, what is the chance you can have a stroke? So, is it necessary to take a medicine or not? All this can be quantitatively
There's more clarity now, less of guesswork and more
clarity,
information
on more information. And the good thing for the patient is that he can understand, yes, this is my chance, not that this guy is guessing and saying, yeah, you must take a medicine. It's not like that. So, you can ask what is my risk factor. So, if you are evaluating yourself regularly, they can guide you like, okay, this is your chance, now you are very safe, you don't have to worry at all, just follow me after 1 year, great. Now, you have a higher chance now, your risk is a little bigger. So, let us see after 6 months, or see, since you have a family history, since you are diabetic, let us do this echo and treadmill test to make sure that your cards are fine, or if they find the changes in that, let us at least do a CT scan of your chest to see if there is a block. Depending upon your age, depending on risk factors, these can be modified and can guide you very well.
So, doctor, what is the role of mental health in heart diseases? Because stress and tension is a part and parcel of our lives. So, how much does that contribute to heart diseases?
Yes, now this is also one thing that is, if I don't know whether I can call mental stress and anxiety as modifiable or non-modifiable, now it's very confused, because people tell me that, doctor, I cannot change this, or my job is this, that I cannot control my stress. So, I don't know whether it is modifiable or not modifiable, but I can tell you it is modifiable, that is the truth, but people believe it is not modifiable now. See, stress or anxiety, when you have stress or anxiety, it is not just one part of your body, it is your whole body that is affected. I can tell you one example. See, people who are very stressed, they tell that they have twitching in their eyes, and they feel that they have generalized weakness.
Even headaches, tension headaches.
See, the nervous system is affected. People tell you that, doctor, I have dry mouth, I have dryness inside, I am not feeling energy. See what is happening inside your mouth. You have gastritis, recurrent abdominal discomfort, gastric ulcers. Your stools are not good. Your sleep is disturbed. All stress. Now, when this happens inside the body, if it is affecting from your hair to your toe, everything is affected,
including the
internal organs. Well, heart is not spared. The blood vessel is not spared. When you are stressed, your heart rate is very high. You don't want to have such a high heart rate. If the heart is beating at more than 100 beats per minute, where it should have a much less, the load on the heart is more. It's going to die early. If your stress is very high, the pressure goes on increased, the blood vessels inside are damaged, you have again a heart block, a block inside the vessel causing heart attack. So, stress will not only cause a cardiovascular disease, but stress is the one thing that is going to really destroy you totally. So, from where did it come? It was not caused by a mosquito or a housefly or because you didn't wash your hands. It's because you are generating it yourself. Maybe all of us, including me with my profession also, we must find ways or means to relieve our stress. Now, if you ask me, doctor, it's a very vague advice you are telling that how to relieve it. There are a number of ways, One, learning to let loose is the best thing I would tell my patients. Let it loose, let it go. You can't carry it, just leave it. That is the first thing you do. Maybe when you are promoted to a manager, you feel that, oh my God, good. What was good? Actually, nothing was good. Nothing was good. Maybe the amount is more. Let us try to leave something when we get something, so that that part stress is less. And then, of course, social activities. Now, when we on the World Heart Day, when we talk about heart diseases, very rare things which we miss or underlooked are social gatherings. Now, we were unlucky that 2 years COVID was there, but now it's not there anymore. Social gatherings are something that gives more of positive energy, more of endorphins, feels good, you are more human. These
puts
will
you
help
at ease,
and this helps relieve stress. So, all such activities, yoga, aerobic, open ground physical activities,
learning a new
language
or having
or learning some art, some music,
yes.
your hobbies which you had dreams in your life, just go for anything that keeps you calm and relaxed. Definitely on a hard day, I can tell you, it will improve your longevity for sure.
And there's another area of concern. You spoke about COVID just now. What we have observed is, a lot of people, they recover from COVID quite well. They seem to be fit and fine. But we have heard of cases where within the next 2 or 3 months, they die because of some heart issues, normally a heart attack. So, how does COVID affect the health of the heart? Does it have a direct link to it, or?
Yes, Anupama. Now, in this era, well, we have to speak much on that. It is true what you have said, that there has been a very plenty of observations. We find that people who are very healthy also post COVID have a sudden heart attack, and people who are having underlying heart diseases are more prone to have heart attacks and blocks or death because of COVID. Now, if you look at this thing, how I can tell you how powerful or how vigorous this disease was. See, COVID at the time of this infection, if you see these deaths in the first 2 weeks, they were caused by the virus inside the body, and the body is reacting against the virus and you die. But after this COVID is gone, you have a time span where you come across a very large number of mortalities which you do not think it is COVID, due to COVID, but because of something else. But that death, if it was because of a heart attack or a heart disease, could have been attributed to the COVID. How? COVID infection itself creates a prothrombotic effect. Now, I will just explain what that is. Prothrombotic means COVID is one factor that if you have this infection, your body is now prone to have more clots. So, more clots means more block. So, if you had a COVID infection, there is a chance that you can have a block inside your vessels, either those vessels supplying your heart or supplying your lungs. That is the reason why you would have seen that people who had COVID after 1 week or so develop breathlessness, difficulty breathing, and then they do this blood test, and the doctor will tell you, oh, there is a large block inside your blood vessel supplying your lungs, and then they do these medicines and you come out of it. Just like that, you can have blocks not only inside the blood vessel supplying the lungs, but also the blood vessel supplying your heart, can have a heart attack. Similarly, COVID can also cause damages inside your body, where changes will affect your muscles of the heart. So, when the muscles of your heart are affected, the muscles fail to pump all of a sudden. and you can have a sudden death. Also, it can affect the conduction system, the current which I mentioned earlier. So, when the current system is affected, your heart will no more pump, or your heart will no more beat, or beat in a haphazard fashion, causing death. All these are sudden deaths that happen, and this guy has never been aware of this. So, this is a guy who did not have a heart disease. Imagine that if you are having a heart disease and you had a COVID, the chance of the heart disease are much higher. It's not to scare anyone. Now it's nothing to scare. It's all over.
It's better to be aware and take precautions.
Yeah, that there is something like that, and so that once you have a COVID, you have a heart disease. Let us check this out.
Yes.
That am I having any chance of a block? Is my heart, is my vessels good? There is no harm evaluating for that. I would say if you have a heart disease, you must evaluate whether you have a chance of any of these diseases I mentioned.
And what about the role of exercise in heart diseases? Because we are all into some form of exercise or the other, and there's a general conception that the more you exercise, it's better for your heart.
Yeah.
But at times we go to gym, we even lift weights, and so does that affect the
True. Now that is also something, and I don't know whether something is good. Maybe more good is sometimes bad. Now, thanks to all this awareness about health, and thanks to somewhat of fear that the COVID has created, people are now looking more into fitness conscious, though late, but it's better to be late than never. So, it's good that you are having a physical activity, but your point was, is it good to have more physical activity? The answer is always no. There is no. The answer is no, because I would say exercise at some times shall be considered as a pill even. Say for example, you are having heart disease, you are having a stroke or a heart attack few months back, or you have on a medicines for that. Now suddenly someone said, no, you have to increase your exercise. You should not be doing it. Anything you do in your body for exercise should be gentle, slow, and not at stake of any of your organs. Say for example, somebody said, I went to the gym, I saw this guy is climbing this treadmill at 10 speed, and he is having inclination of 15. My God, I cannot do it, let me try this. That won't work. The chance of you to die of heart disease is more when you are exerting to this level that you have not done before, is more than you would have died even without doing any exercise. So, of course, doing more of exercise, it's not that you are doing more hours, but more than what you can bear is absolutely not considered good at all.
It's putting more strain on the heart. More
strain on your heart, your blood vessels. So, no, you are not advised to do anything more than what you can tolerate. If you would like to, it should be done gently. See, you see bodybuilders. Now, they are trained to be bodybuilders. So, you see six-pack in my times Arnold Schwarzenegger at that time, and I tomorrow think of being an Arnold Schwarzenegger. It's not going to do good for me. He had gained this over a period of time. It's not one day.
Under right guidance, and the proper
right
diet
training,
as well.
Yes, and right health. Now, you are unhealthy. You cannot be him all of a sudden. I'm just mentioning his name. So, whatever exercise you're going to do, make sure that this exercise is fit for you. That is why the World Heart Federation says that 150 minutes per week is sufficient of moderate to severe intensity. That's all. So, it's 30 minutes per day for 5 days a week is good for your heart. You don't have to do much things. And if you are into vigorous activity, you would like to have a vigorous to severe exercise, 75 minutes per week is enough if you are doing a vigorous physical activity, or moderate to severe 150 minutes per week, that means 30 minutes per day for 5 days a week. That is best for you if you are looking for a hard side. Of course, you are bodybuilders, you are on another segment, but anything over exerting for a common man without proper guidance, training and health checkup is dangerous. Yeah.
So, doctor, you spoke about modifiable risk factors. So, could you please throw light on the measures that we can take to prevent these kind of lifestyle diseases?
Yes. Now, since we spoke about diabetes, hypertension, cholesterol and the diseases and how they cause the heart attack, I would like to add a few points on the known diseases modifiable, like smoking.
Okay.
Yeah. So, very importantly, smoking. There is no way I can mention that even one cigarette per week or per month, nothing like that. It's absolutely no to even one smell of a gas, whether it is you smoking or someone smoking. So, even someone else smoking is not good for your heart.
Passive smoking is
so
equally dangerous.
Yeah, so, smoking is not there at all. For smokers who are doing it, I can tell you, if you completely quit smoking, 2 years will be enough to get back to near normal, and 10 years to be a normal man. So, all those who are smoking, let us stop it now. so that you are saved and your neighbor is also saved. So there is nothing to argue on smoking factor. Then the others were stress, which we discussed, then sleep. I would like to add some light on that. See, sleep is one thing that is most necessary for you, if you ask me nowadays, because none of us are sleeping comfortably. You must have 7 to 8 hours of sleep, must. Healthy sleep. You know why we use the word healthy? Sometimes this partner used to tell me, doctor, my husband sleeps and immediately snores, he is having a good sleep. Now, snoring is not good sleep at all. Snoring is actually bad sleep. The more you snore, more chance you can have a cardiovascular disease. So, good sleep means a peaceful, calm sleep. It is not that snoring. Okay? So, you need a good sleep. Now, sleep, stress free, no smoking, and avoid diabetes. If you are having controlled diabetes, prevent hypertension, cholesterol. Now, for that what you do? Maintain a strict diet, do regular exercise, and please do regular checkups. Visit a doctor, whether you are healthy or you are having a disease or not. Visit a doctor. Tell him that, doctor, I would like to have an evaluation done to see whether I am prone to have any of these risk factors heart disease. What is the big deal in doing that? They will not ask you to do a whole array. The basic test to make sure that you are free of diseases.
Doctor, would you like to share any takeaway message for our friends today before we wrap up?
Yes. On this World Heart Day, that's what we are talking about. Definitely, I would like to reiterate the 3 pillars that the Federation would like to spread. 1, heart for humanity, heart for nature, heart for you. So, these 3. I think this is enough for the world and for yourself to have a good life.
Thank you so much, Doctor, for joining us on the show today and for explaining to us in detail about heart diseases. Really appreciate it. Thank you so much.
Thank you. Thank you.
So, friends, I think we should follow Dr. Rahul's advice. Let's embrace a healthy lifestyle. You know, you're never too young or too old to start taking care of your health. Make your health a priority. You owe it to yourself and to your family. Eat in moderation, exercise in moderation, stay hydrated, and be happy and smiling always. Till we meet again next time, this is Anupama signing off. For more informative episodes like this, don't forget to tune in to BMC Global Live Al Hilal Health World every Tuesday at 8 p.m. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shop.